Hi, my name is Alicia.
And I'm Marisa, and we're with the North Carolina Harm Reduction Coalition.
So what is HIV, Marisa?
So HIV is human immunodeficiency virus. It's the virus that can lead to acquired immune deficiency syndrome, which is AIDS. HIV attacks the body's immune system so it cannot function properly. The human body cannot get rid of HIV. Once you have it for life. However, there are many treatments available to manage HIV.
Who can get HIV?
Anyone who is sexually active or shares any drug paraphernalias, people who are at higher risk if they have sex without a condom or on sexually transmitted infection, an STI. Sharing any injection equipment can spread HIV. This includes cookers, cotton, or water.
And syringes.
And syringes. Thank you, Alicia.
You're welcome. What are the symptoms of HIV?
Okay, acute HIV symptoms include a fever, a tired feeling, swollen lymph nodes, swollen tonsils, also called tonsillitis, a sore throat, joint and muscle aches, diarrhea, or a rash.
So I might feel like I'm getting a cold.
Yes, you might. Or even feel like you have the flu with the tiredness and the sore throat.
What are the risk factors for HIV?
Well, the risk factors of HIV are male-to-male contact, people of color, sharing syringes and other injection equipment, trauma, and having sexual relations with unequal power structures, sex workers or abuse, sexually transmitted diseases, or having multiple sex partners.
How can we prevent the spread of HIV?
Use a condom. That's number one. Use a condom, or get some PrEP, which is pre-exposure prophylaxis. You use that before a sexual encounter. You use that every day. You use it. So if you're having sex without a condom, you're protected. Don't share injection equipment, and get tested regularly. You have to know your viral load, okay? Because your viral load is the amount of HIV a person has in their system.
What is PrEP?
The acronym means pre-exposure prophylactics, and this is a medication that you take to protect you from getting HIV, okay? PrEP can stop HIV from taking hold and spreading throughout your body. It's extremely effective at reducing the risk of HIV when taken correctly. However, it can become less effective when not taken every day. So you have to take it every day. You can't skip a day, you got to take it every day. And it reduces the risk of getting HIV from sex by 99% when taken as prescribed. PrEP reduces the risk of HIV by 74% among people who inject drugs when taken as prescribed. Some of the PrEP medications include Truvada, which is PrEP, that protects all people who have sex or use injection drugs. Truvada works by taking 2 pills, 2 to 24 hours before a possible sexual exposure to HIV, and then continuing to take 1 pill each day until 2 days after their last possible sexual exposure. Generic forms are now available, so it can be cheaper and easier to access. Descovy is PrEP for sexually active men and transgender women at risk for getting HIV. Descovy is a pill that must be taken once a day, every day. Descovy has not yet been studied for HIV prevention for receptive vaginal sex. Apretude protects all people from HIV exposure. Apretude is an injection medication. The injection is given once every other month in the buttocks, on the gluteus maximus. Apretude is extremely effective because it is easier to take correctively, but it is expensive, so there might be a barrier with that.
Wow, that's really changed. It went from a handful of pills to
now all these other
right.
things. See, we have so many options to protect
That's
themselves.
encouraging.
It is encouraging.
You know?
It really is.
What are some social issues that surround HIV?
Well, some social issues that surround HIV, homophobia, and that's been going on for a long time. Racism, poverty, and limited access to quality health care all affect the likelihood of HIV and the health outcomes of HIV positive people. Okay, that homophobia has been around for a long time. People still believe that HIV can be caught by using the same toilet, drinking out of the same cup, eating from the same fork. That's still going on. That's, sitting in the same chair. So there's a whole, that is always around. So there has to be education on that because we know that it's not so. So we have to educate.
There's a lot of that goes on when you're incarcerated. People believe that, if you're using the same tray or you use the same toilet or you're in the same cell that you could catch HIV, which is incorrect because it dies on contact with air. So if you get into a fight, you don't have to worry about that.
Yes. We have to get into the correctional facilities, get into the jails, and we have to educate. We have to let them know that, that is not how you can contact HIV.
What populations are at higher risk?
Gay and bisexual men of all races and ethnicities. They are the group that's severely and disproportionately affected by the epidemic. Men who have sex with men represent approximately 2% of the U.S. population, but accounted for 61% of all new HIV infections in 2009. By race, age, and risk group, young, black, gay, and bisexual men ages 13 to 29, education, are the only population in the United States in which new HIV infections increased between 2006 and 2009. African Americans are by far the most affected racial ethnic population in the United States. African Americans represent 14% of the U.S. population, but accounted for 44% of the new HIV infections in 2009. The HIV infection rate among African Americans was almost 8 times as high as that of whites in 2009, and among African American women, it was 15 times higher than among white women. Latinos are also disproportionately affected by HIV, representing approximately 16% of the total U.S. population. But according to 20%, accounting for 20% of all new HIV infections, in 2009, the HIV infection rate among Latinos was 3 times as high as that of whites. And this data came from the CDC.
What is PEP?
PEP works like this. PrEP you take on a daily basis before you have sex. PEP, on the other hand, is if you believe that you have been exposed to HIV, okay, this is a medication that can prevent you from getting HIV. So PEP is the use of an antiretroviral drug after a single high-risk event to stop HIV. Seroconversion basically means your body has been infected with HIV. PEP must be started as soon as possible to be effective, and always within 72 hours of a possible exposure. If you're sexually assaulted, there are many resources available to help you get PEP for free. If you're exposed for other reasons, do not have insurance, there are still resources available to help you get PEP for free. So PEP is available. You could get it for free. You don't have to buy it. The health department, a freestanding community health center, or maybe even your physician's office will offer PEP.
What does knowing your status mean?
To know your status, you should get tested regularly. But knowing your status means that you're checking to see your viral load, okay? To see how much of the HIV is in your system, okay? How much of the virus is in your system. If you have a low viral load, that means that you're undetectable, so you're untransferable. So that means you can't give it HIV because your load is very low, okay? But you should get tested regularly, okay? Rapid testing is available for free in many places. Okay? And it's quick and only involves a finger stick. And you do rapid testing.
I
do.
do.
You, Alicia?
I do.
Okay.
I do.
So how long does it take for you to know that you have
Well,
HIV?
If I'm exposed to HIV and I don't know about PEP, I have a window to get tested
Okay.
before it will show up in my system, which I might not even think about until I feel kind of like I'm getting a flu.
Yeah.
It would be 18 to 90 days.
Yes.
That's the window. So if I am exposed to HIV and 10 days later I'm like, oh my God, what am I going to do? I could still get tested, but it's not going to even possibly show up. So it's important to get tested, especially after the 90-day mark. That's a good time.
Or you could take PEP, because PEP, right, it's that 72 hour. Within 72 hours, if you take the PEP and you do have the HIV in your system, right, it shuts it down.
Which you can get for free.
Yes.
Yes.
Yes. Department of Public Health, or at a healthcare center, or even at your doctor's office. Or who knows, maybe the pharmacy.
You can get it at syringe exchange programs
Okay.
as well.
See?
And if you donate blood, I know that they test your blood for all of that. So
Okay.
they
This
will.
way you'll know.
Yeah. And if you're a sex worker, there are ways to prevent the spread of HIV also, like not brushing your teeth before giving oral sex,
Okay.
because when you brush your teeth, your gums might bleed.
Oh.
There's a lot of stigma that surrounds HIV. Are you familiar with any terms that could reduce that stigma?
Education, we have to educate, and it's not just on the mainland in the United States where there's stigma. There's stigma all over, because I'm from the Caribbean, and in the Caribbean there's a lot of stigma, and the stigma is a lot of it is geared towards the LGBTQ plus population. And I believe that if we could get into that community and educate and get to know that community and their lifestyles, that we could reduce a lot of stigma.
There's another way to reduce stigma, and that's with our language. So instead of saying that somebody's infected with HIV, you would say that they're living with HIV.
Okay.
And so even just by using our language, we can reduce it.
Not just language, but the way we approach our approach,
Yes.
and it's how we say things, and what we say to people of different communities, instead of being culturally sensitive, and just take all that bias away, because there's a lot of bias. If we could take that away, we could put some education in there, and we can reduce stigma in that way, because they can pass it on. We could also, when we talk about HIV, talk about it as not just a disease, or not just an illness, but as a chronic disease, because we know that HIV is chronic. There's no cure for it. It's like diabetes, but it's manageable.
It is manageable because undetectable equals untransferable. And when you're untransferable, you don't have to even disclose your status legally. That in itself is easier. An abusive relationship, the woman might not be as quick to go get tested, right?
Or she might not be as quick to wear a condom, or maybe her sexual partner may not allow her to wear a condom because
Exactly.
he's in control.
Or if you're a sex worker, or even in that abusive relationship, and you have really rough sex to where there is a blood and just bodily fluids, all that. Yeah, in abusive relationships or as a sex worker, you're already at higher risk because of violence and...
Well, that's that power thing, because you really, in relationships like that, you really don't have any power. Your power is taken away. Someone else has your power. They have your power because they're paying for a service, and when they pay for a service, they feel like they're in power.
Yeah.
It's just like being in an abusive relationship where the woman is not working and the man is working, or vice versa. They feel like they have the power over you because they're taking care of everything. So it's like whatever they say, go. So if they say no condom, it's no condom. And if you don't have anywhere to go, you wind up unsheltered. Because what's going to happen if they tell you have to leave? Since they're paying for your shelter. So that's where that power comes, that unequal power.
I feel like if you're a sex worker, it's always important to have tennis shoes
Okay.
so you can
Dash,
haul
run away.
it. You bust ass.
Well, that's a good remedy.
I'm serious. That is actually something that's a safer sex work
To dash.
thing. No, to have tennis shoes.
Tennis shoes. Yeah,
To wear your tennis shoes because that goes on in all sorts of settings. What do you mean when you said unequal power dynamics?
Well, that goes with socioeconomic status. The wife is not working, the husband is working, or it could be human trafficking. So there's no document of the person. The partner is in control because they have the money, they have the shelter, they have the food, the clothing, and this person can't get out and work and can't have their own. So they have to do what the other person says because that person holds the power.
How can we prevent the spread of HIV?
So we can prevent the spread of HIV by using condoms or by PrEP, which is pre-exposure prophylactics, and this can be used before sex. Don't share injection equipment, and get tested regularly.
Is there anything else that you can think of about?
Well, I would say to know your status. If you are incarcerated, when you at post-incarceration, you should always know your status. Wear a condom. Try to get some PrEP. If you have any encounters with someone that you think is at high risk, get access to a healthcare provider or the health department and get you some PrEP. And take care of yourself.
And when you're incarcerated, go ahead and utilize those resources.
Yes, definitely.
Because you can go ahead and find out your status and go ahead and start getting care because untransferable,
Detectable?
undetectable
Equals
equals untransferable
Yes.
equals you don't even have to share your
That's it.
status.
Yeah. Well, unless they want to, They may meet someone that, you want to be vulnerable with and you want to share your status, so.
That's how you get tested for HIV. So you're here to get tested for HIV.
Yes, please.
Have you put yourself at risk?
I believe so. I use IV drugs with my partner.
So this is just what we put your specimen in.
Okay.
This process it's not that bad at all.
So is this one just the finger stick?
Yes. All right, can I see your finger? So it makes you nervous to get fingers stuck?
It's not my favorite, but it's better than doing the full.
The full stick.
The full confirmatory, yeah.
There's a Band-Aid.
Thank you.
This test is going to take about 5 to 10 minutes.
What happens if it comes up as positive?
If it comes up as positive, then we will refer you to your health department and get you on medication. And one thing to remember is if you take your medication on a regular basis or as directed from the doctor, you will become untransmissible, which is untransferable. So your partner won't get HIV too.
Cool. And if I'm positive, they also have to test my partner?
Absolutely. And anyone else that you guys may have,
Use with, have sex with.
yeah.
Yeah.
Do you know of any ways to prevent the spread of HIV?
Only the ones they like said in sex ed, like wear a condom.
Did you know that IV drug users can spread HIV through syringes
Not exactly, but that makes sense.
in the water?
In like all of our shared supplies.
Pretty much. It does die on contact with air, but it's the bodily fluids,
Anything with blood.
anything with blood, or even breast milk. You see the line that's popping up right here?
Mm-hmm.
That means that you are negative.
Awesome. Thank you so much.
So it's important to not put yourself at risk again, okay?
And that means getting clean supplies.
From your local syringe exchange program.
Yes.